Hello, Uganda. Mwanguzi Shadrach from Health Touch Uganda. Today I'm going to be talking about what you are supposed to do at home to help the person who you suspect has been intoxicated by alcohol. Many people take alcohol for different reasons. For example, it can be a child who lands on a bottle of alcohol and they drink it like any other drink and they end up being intoxicated. Some other people do it deliberately. Some of them, out of stress, out of anger, decide to, actually in some it is attempted suicide and they end up taking a lot of alcohol. So some of the things you may look at and sound a warning: we find someone who seems to be confused and they have a smell of alcohol in their breath. When they are talking, their speech is slurred. They look to have a slightly different behavior from their normal behavior. They tend to perceive things a different way. Some of them are telling you they want to vomit, others are vomiting. Someone is excessively sweating. When you look at their eyes, that pupil, that dark part of the eye is kind of wider than normal. They may be in a collapsed state. Some of those things tell us that probably the person has taken a lot of alcohol. So there are some things which you're supposed to do. Of course, there are others which people do out there and are not good, and I'll be discouraging them in this video. So, number one, when someone is still conscious, try to talk to them and reassure them that they will be okay. Usually, some of them tend to become cold, and when the temperatures go really low, it's disastrous. So, if you can get something thick and cover them up, if it's a blanket, a jacket, and cover them up so that they keep warm. Sometimes when we find someone who has collapsed and they are smelling alcohol, we tend to over focus on the alcohol and we may miss out on other injuries. Someone may have other injuries like head injuries. Someone may actually have stroke. Someone may have a heart attack. Someone may have other problems, but because they also smell alcohol, you may think it is just alcohol. So you can check them properly, and if you suspect something else, it should direct you into which kind of agency you need to get them to a health facility. And if you can call anyone to give you a hand, the better. While you're waiting for the help, put the person to lie on their left, on the left side of their body. That helps them to continue breathing, and even when they try to vomit, they don't choke on vomiting, and they don't take in these things in their lungs, which may actually also cause a lot of problems. Try to monitor them until when they recover, as you also wait for the means to take you to a health facility. There are things which some people do and are not good, and I want to discourage them. In as much as you may want to blame them, why have they taken the alcohol? You think they have always been taking probably a lot of alcohol and they are used. When you see them looking unusual, please don't ignore them. Give them the attention. Don't give this person cold water. Don't make them shower, because some people, they just get a bucket of water and pour it on the person to chase away the intoxication, but that doesn't work. That shock of the cold water can make the person unconscious, which we don't want. When the person is semi-conscious or they are not really themselves, they have lost contact or touch with reality, don't give them things to eat or drink. Some people have a tendency of giving drunkards or intoxicated people things to drink, things like urine. He used to give an old woman's urine to a drunkard. But please don't do that to a person who is semi-conscious, because it will cause vomiting, choking, or even aspiration of those things. Then, don't panic, you as a first aider. Even if the things you are doing are not probably happening the way you expect them, or the situation is is just worsening, don't panic. Just stay calm, because once you panic, you may not actually do the best thing to help out this person. So those are some of the things that you can do to help a person who has been intoxicated with alcohol. Mwanguzi Shadrach, Health Touch Uganda, follow the light.